Welcome. Thank you for joining us today. Today, we are talking with Claribel Garcia. Claribel is a licensed clinician and substance use disorder counselor working in domestic violence residential settings, as well as substance use disorder treatment in New Jersey. Claribel, thank you so much for talking with us today.
Thank you so much also for giving me the opportunity to be here today and share my experience, strength, and hope with everybody. Thank you so much.
Absolutely, our pleasure. And so, first, I'd love to just invite you to introduce yourself and share with us what inspires you in this work and sustains you in this work.
So I've been doing substance use disorder for about 11 years and domestic violence as well. I started actually at JBWS in Morristown. I started doing my internship 11 years ago when I was a senior, and doing my practicum at Felician University. So I actually started working with the a male abuser part at the beginning. They had a actually like a 26-week service for them, and I used to be in charge of the Spanish population there, and I really loved it. And at the same time, I started doing my internship at Newbridge Medical Center, and I started in the detox unit, and that's where I found my passion for both fields, substance use disorder as well as domestic violence. Since I did it for a year, I said, you know what, this is what I really want to do. So I actually started getting my LCADC and I took the domains. Then I had finished all my hours and I ended up with the LCADC and I just passed the NCE and I have the licensed associate counselor as well. And I'm going to pursue the LPC, which is the licensed professional counselor. So, you know, God has a plan, and I believe that this is my passion, and that's where my heart is as of right now. I've been doing it for all those years, and I just feel like it was yesterday. I feel I'm not working. I feel it's my calling, and I feel this is where I could help others due to my own experiences that I am actually a survivor from domestic violence since 2006, and then I am a survivor from substance use, which is it used to be alcohol. I have 11 years, going on 12 years in April 2022. So I feel just blessed that I could give back to the community, especially to people that are still suffering from any substances abuse, any substances use disorder or any domestic violence, which is could be any type, verbally, physically, emotional, spiritual. And I am able to give them my hand and help them try to break the cycle of abuse and the substance use, which is crucial right now, especially during the pandemic. So I feel very blessed to be here and I feel very blessed to be able to help the community we serve.
Mhm. Yeah, it is really such a privilege and honor to be able to just be available as a resource, as to be able to help others.
Yes, it is. For me, it's a blessing, and at the same time, I actually right now I'm helping the community in Paterson, and we do different type of work. I actually help them in a shelter as well as the outreach community. So basically, when they are coming to shelter, and I do an access questionnaire with the cage, which contains 4 questions, and if they are positive, I have them I see them twice a week inside the shelter, and I give them my cell phone number so they are connected with me 24/7. My number ends in 911, so I always tell them when you have a spiritual emergency, call Claribel. So they usually get connected with me all day, and I help them so much. We work together as a team as well. If they are negative, if their results are negative, they still get my number in case in the future they have any concerns, any questions about substance use disorder or domestic violence. At the same time, I also have the DVS, which is the domestic violence certified specialist
Mhm.
certificate. So I also have that. So that helps me as well to help them, guide them. When they complete the program or they leave the shelter, we have what is called outreach. So I'm still helping them until they reach their goals or their long-term recovery. I also send them if they need to go into detox. I am basically the bridge who get them into like detox, different hospitals, different facilities in Paterson, in Paramus. If they need medical treatment like Suboxone, Vivitrol, Methadone, I'm the bridge also that connects them with the services or the level of care needed. So this is, I love what I do. So it's basically holding their hands and letting them know they're not alone in this and that they could break the cycle and they could achieve long-term sobriety. Because if my higher power did it for me, it could do it for you too.